My name is Kathy Huang. I'm the director of Endometriosis Center. We see a lot of patients with endometriosis that come in with pelvic pain. For different conditions, they come in with painful periods. They come in with having difficulty having intercourse because it's very painful. So their pain can't be just during the menses or throughout the entire month. So the first step we do actually is get an MRI for the patient. So I've worked very closely with Nicole Hinman from the radiology department to develop an MRI protocol that we've seen can diagnose endometriosis up to 85% of the time, so that it would be a less invasive way to do it rather than surgeries. We want them to be pain-free. That's our ultimate goal, so that they can go back to living lives how they're supposed to. So I think it's really sad when patients come in and they've been misdiagnosed for many years and they have these unrelenting pelvic pain. And when we have patients who can't breathe every month during their menses because of the endometriosis in their lungs, that's just really unfortunate. So we want to one, diagnose them, and then two, treat them, but also because some of these patients have had pain for such a long time, just surgery alone and surgical resection of the endometriosis lesions alone is not going to help them enough. That's why we have a whole team helping us with the treatment of the patients. After surgery, many of them have reported to not have pain anymore. They can return to their daily lives. Oftentimes before surgery, they're telling me that they are debilitated for 3 to 5 days during the month. During my fellowship in Stanford, we actually treated a lot of patients with endometriosis, and that's what initially piqued my interest. And I think one of the really difficult things about endometriosis is it's extremely difficult to identify. So you should have to have a very high suspicion for the disease. We realize that most people do not know how to approach the disease. So I really made it my goal to focus on this group of patients. They are not being heard a lot of the time. So they find it very comforting that someone's willing to acknowledge their pain.